Turning now to the latest on COVID-19 as cases skyrocket across the country due to the Omicron variant. New guidance is coming from the CDC. Our Michelle Choi is live for us this morning at the Med Center. Michelle, this new guidance appears to be less restrictive.
Hey Steph, yeah, it's definitely more relaxed. So here's a breakdown of what you need to do if you test positive for COVID or you come in close contact with someone who does. First, let's talk about isolation. The CDC says anyone who has COVID, whether you're vaccinated or not, should now isolate for 5 days. That's half the amount of what was previously recommended. After 5 days, if you have no symptoms, you can return to normal activities, but you should be masking up around others through the 10th day. If you still have symptoms after the 5 days, stay home until you feel better. Now let's talk about quarantine. This is for people who've been in close contact with an infected person but haven't tested positive. If you've gotten a booster, the CDC now says you can skip quarantine if you mask up everywhere for 10 days after exposure. It's also recommended you test yourself on the 5th day. This also applies to you if you've been vaccinated with a 2-shot dose within the last 6 months or a 1-shot vaccine within the last 2 months. For all others, including the unvaccinated, the CDC says you should quarantine for 5 days if you come in contact with an infected person and mask up for at least 10 days. Asked for why the CDC is adjusting guidelines despite cases going up.
With the strain on school, the economy, and they determined that the risk of shortening the isolation period is the benefit of doing it outweighs the risk.
Something else to note, health officials say people are most contagious 2 days before and 3 days after symptoms develop, which is why doctors stress that the vaccines and boosters are still your best line of defense against COVID. Steph?
Quite honestly, Michelle Choi, a lot of numbers to keep track of this morning. Thank you for breaking it down for us. Those new guidelines from the CDC come as cases also surge across Houston. The Texas Med Center says as of December 23rd, more than 5,000 people per day reported testing positive in the greater Houston area. That compares to about 2,000 new cases per day from the week before. The rate of one infected person infecting others is also up, and so are hospitalizations in the Med Center.
The Omicron variant started spreading right in the middle of the holiday season, and now doctors are seeing more kids getting COVID around the country.
As Britt Conway reports, children's hospitals are bracing for things to get even worse.
On the heels of holiday celebrations, heading into the new year, Omicron is spreading. Cases are rising, and now more kids are getting hospitalized with COVID-19. And we're closing in on the record high for pediatric hospitalizations set in September. In Houston, children's hospitals say they're getting ready for more kids with COVID to fill up beds there. With one pediatrician saying, "I think we are going to see more numbers now than we have ever seen." An attending physician and infectious disease specialist at Ann and Robert H. Lurie Children's Hospital in Chicago says case numbers there are 3 times as high as the hospital's previous peak last December. In Cleveland, the director of pediatric infection control at Rainbow Babies and Children's Hospital says effective monoclonal antibodies, a life-saving treatment, is in short supply. State data shows New York City pediatric hospitalizations increased 5-fold over a 3-week period. And in D.C., the infectious disease chief at Children's National Hospital says close to half of the COVID-19 tests that they're doing are coming back positive. But it's not just these cities. Nationwide, on average, pediatric hospitalizations are up 35% in just the past week. Hospitals are bracing for a busy January as health experts continue their vaccination plea.
All done.
I'm Britt Conway reporting.
And that brings us to the morning's other coronavirus headlines. Counting down from number 3, a hospital in Israel is testing out a 4th dose of the COVID vaccine. Yesterday, 150 medical personnel were given a second booster. The country is considering offering another dose to vulnerable people in an effort to stay on pace with the new variant. Number 2, Texas has run out of a key treatment to fight the Omicron variant. Infusion centers offering monoclonal antibody treatments have exhausted their supply. Centers in Austin, El Paso, Fort Worth, San Antonio, and the Woodlands all say they won't be able to offer more treatments until sometime next month. And number 1, Dr. Anthony Fauci says Americans should stay away from those big New Year's Eve parties. His advice is to avoid gatherings where you don't know the vaccination status of all the guests. Health experts warn crowded indoor parties could accelerate the the ongoing Omicron surge. And Steph, that announcement comes as millions of people are still traveling in the middle of the holiday season in advance of New Year's.
Yeah.